when you get a pile of laundry out, like from the dryer, and then you just lay on it. I don't know if anyone else does that. It's like that, but more localized and more therapeutic, of course.
There's a little bit more therapy than just some hot jeans laying atop your back. Hey everybody, this is Mike from Kalkstein Chiropractic. We've got another beautiful day here at the office. I've got Dr. Jonathan with me, and today we're going to get into some Category 4 laser therapy. So I know laser sounds a little bit intimidating, but it's really just a nice warm kind of massage ball modality. It's really good at bringing in fresh oxygen, fresh blood into an area. So let's go ahead and get started.
Let's do it, Mike.
And I'm going to turn on the machine here. So typically a laser treatment at our office lasts anywhere from 3 to 4 minutes, depending on the area that we're treating, depending on the severity of the problem. In Dr. Jonathan's case, we're going to be treating a couple different areas. So we're kind of sitting a little bit here on the SI. We're going to go up into the traps and the neck a little bit, just really giving him an all-over kind of TLC treatment, especially as we're coming towards the lunch shift here at the office. We've been doing a lot of adjustments, been staying busy, so it's nice to use the laser to kind of cool things down in between. So typically with the laser, like I said earlier, it is a warm healing modality. It's not meant to get hot. It's not ever meant to, get to a temperature that it should burn the skin. That being said, Dr. Jonathan, if it gets a little bit too warm for you, just let me know and we'll turn it down a little bit.
I'll let you know. It feels really good right now.
Perfect. It's always important to kind of let the patient know, the heat is just a byproduct of that laser, of the healing modality itself. The heat isn't necessarily what's causing the healing process to occur. Now, granted, it feels nice, nothing wrong with a warm massage, but again, we can always turn it down. We want to value the patient's comfort level more than anything here. So the laser is a nice complement to a couple of the other modalities we do here in the office. Dry needling is a common kind of 2-in-2 modality that we'll pair together with the laser. A lot of our other treatments are a little bit more evasive in nature than the laser therapy. So this is kind of a nice way to calm things down. So we're just kind of sitting all up in the traps and the cervical spine area. Really just, any spot that we've got some inflammation, this is going to be really good at, again, kind of getting some fresh blood in there, fresh oxygen, and really just letting that area kind of get through with that healing process. Inflammation is good, but we never want it to hang around for too long. It's the first step of the healing process, but we've got to eventually get the body out of that inflammation. So we're about halfway done with our treatment of the laser therapy here. Again, the laser treatments are never terribly long. They're kind of nice, short, right to the punch, if you will, in terms of treatment. But that definitely doesn't take away from how nice it feels.
That's the truth.
And Dr. Jonathan can attest for that right now, too.
Feels like when you get a pile of laundry out, like from the dryer, and then you just lay on it. I don't know if anyone else does that. It's like that, but more localized and more therapeutic, of course.
There's a little bit more therapy than just some hot jeans laying atop your back.
But that's the kind of sensation that reminds me of.
That's a really good example, I feel like, of what does the laser therapy feel like, because a lot of times we'll take patients back and we'll say, all right, we're going to hit you with the laser. And you know, everybody's first impression is Austin Powers, sharks with lasers, but you know, it's not quite the same kind of thing that we're aiming for here.
Oh yeah, get right there. A distal trap, supraspinatus tendon. Yep.
So we've found the spot here. We're in the distal traps, the supraspinatus. Again, really just that spot that in the day-to-day activities of the office, the doctors really kind of carry a lot of their stress. A lot of that work comes from up here. Alright, so we've got about 10 seconds left on our laser therapy here. So again, you know, short and sweet, but definitely gets to the point. If you have any interest in trying out, you know, laser therapy, dry needling, any of our modalities, make sure you guys come down to Kalkstein Chiropractic here in Towson. We'll definitely get you taken care of just like Jonathan here, and we'll make sure you get home feeling good. Alright guys, well, like and subscribe to the channel if you want to keep seeing more videos, keep seeing more content, and we'll see you on the next one, okay?